Councillor Des Hudson, OAM. Des is a very well-known member of the Victoria Police with 30 years of service. Current rank is leading senior constable and performs the role of youth resource officer attached to the Ballarat Police Proactive Unit. Has been working with the youth of Ballarat for the past 22 years. A recipient of National Medal, Police Ethical Standards Medal and the National Police Medal. Chairperson and coordinator and life member of Ballarat Blue Light, and coordinates the running of the monthly disco event. Inaugural chairperson of the Ballarat and District Suicide Prevention Network, and has been chair of the network since 2011. City of Ballarat Councillor, South Ward, since 2002, 17 years, and Mayor of Ballarat in 2015-2016, 3 terms as Deputy Mayor. Recently, at the Australia Day Honours in January, he received the Order of Australia Medal for services to youth. Thank you, Councillor Des, and it's so lovely that you can come. So let's welcome you.
Thank you, Constantine. I think my voice will also carry, similar to Kevan, and thank you for that warm introduction, but thank you for revisiting a demon of mine in bringing up Peter Pan. You'd think, how can something so simple be a demon in any person's mind? But 2.5 years ago I was on Millionaire Hot Seat, and after making it through to a couple of questions, it got the nerves out of the system, and I thanked my City of Ballarat experience for lots of media ops that when the big lights were on, pretty cool in the circumstances. Answered my first question, passed on the next, hoping that I'd get back around into the chair, and saw a number of other contestants go out and passed, and finally my turn came back in the lead up to the finish line of being able to hopefully play for some big dollars. I thought at the time maybe pay off the mortgage would be great. That was there. And answered another question, was quite confident, feeling relaxed, engaging with Eddie. And then there was a question that came up it was about Peter Pan. However, of my 4 answers that I had from the scenario that was there, and after doing the 50-50, I was left with Peter Pan or Moby Dick was the story that it was coming from. And sitting there and watching the clock tick down, thinking in my heart of hearts that it's Peter Pan, but what does the mouth say? Lock in Moby Dick. Lock it in. And I can hear myself saying it. I can hear myself saying it. So Eddie, the green light goes on the box because they don't want to give away the money, so as soon as lock it in and then put it in. And off we go to a commercial break. And Eddie's having a bit of a dialogue and a bit of a chat as we go. And he said, "You confident with the answer?" I said, "No, I've looked at the wrong one." I said, "I meant to say Peter Pan, but for whatever reason, Moby Dick came out." And lo and behold, we came back from the ad break, and yeah, I was out at the $50,000 mark. And the next 4 questions, I knew them. That was there. And it's easy to say after you go, "Oh, of course I knew them." But for bringing back Peter Pan, I thought I'd wrestle those demons for some time. So thanks for revisiting. Can I also say thank you for inviting me to come along this evening and be part of what's been a fabulous Friday night discussion, listening to the other 3 speakers. And Rachel, you're welcome to country, especially when you expanded your big meetings. That was fantastic. So thank you for that. But also to Sundram and Rachel for exposing yourselves and telling those really personal stories and the journey that you both take. And to Kevan for taking us on that, I guess, that psychologist view and religion and spirituality, really great as well. I was thinking certainly about what I would say, because I've got no idea what I'm going to say. But I said to Margaret, in terms of being here and talking, knowing the quality of the other speakers, because I'm not an interesting person, I don't have an interesting tale to tell, such as some of the others that were there. But I said to Margaret what I would talk about, the fact, the linking of the day, and Constantine, you mentioned about that earlier, that yesterday was Are You OK Day? And through some of the stories that we've heard tonight, we've heard the word suicide and self-harm and depression and people being at their lowest ebb. And what was it that forced people to go forward? What was that springboard that was able to launch people? So I thought tonight what I would share with you is a little bit of my role with the Ballarat District Suicide Prevention Network and how Ballarat come to have a network and the reasons why we're that and some of our activities, and share that as a catalyst for future questions and discussion. But in 2011, Wesley Mission, who is funded by the federal government for the rollout and creation of suicide prevention networks across Australia, came to Ballarat and called a public meeting because Ballarat had been identified as having a completed suicide rate higher than the national average. And similar to what we read in yesterday's Courier as well, that's supporting that reason as well. So in 2011, the meeting that was convened at the Ballarat North Community House, and it was really well attended. There was probably some 85 to 90 to 100 people squeezed into a room that came from all different sectors of our community, all of whom had some knowledge or had been touched by the issue of suicide, had lost loved ones, had lost family members, had lost work colleagues. But every person in that room felt there was a calling and there was a time for action. And Ballarat at that time, we were the first location in Victoria to be approached and to be formed. We became the 21st suicide prevention network across Australia and the first in Victoria. And in amongst the group that Wesley Mission said, we will help you become a group, we will provide you with some seed funding, but it is really over to your community to be able to come together and work. And you will find your own way as to what you want to champion, how you think you will fit across the community. So we then needed to set up a committee structure, and there was some discussion in the room whether I would be willing to take on the role of chair, and it was one that I was quite happy to do so. And I think it fits within the role of Victoria Police really well, because for every completed suicide, police are present. It's not a natural death. It is one that's unexpected, and therefore a report to the coroner must actually take place. So we are consistent through every completed suicide that happens across communities everywhere throughout Victoria and certainly other states. So I thought there was a really good link for us as police to be represented in that area. It's fair to say though, when you've got a community group of goodwill, and from the outset and when the group is really large, it's probably very difficult to define what you can do in this space that's going to be effective. How do you know what's going to be effective? Because we're talking something that has been plaguing mankind for centuries. People have been choosing to end their own life. And what could we as a group of community people, we didn't necessarily have a great level of expertise around the room of people with significant academic skill set behind us. It was more that community goodwill that was there. So I think for probably the first 2, maybe even 3 years, I felt that we were spinning our wheels. We didn't really know what it was we were meant to do. We had some idea we would come together, we would meet, we would talk about the issues, and we'd form some working parties, but didn't really know how we were going to make a difference. And especially when you're wearing the term suicide prevention network, because what is suicide prevention in terms of keeping people safe? And I guess from my view, and Kevin was touching on some of that, it's the connections that we have across community everywhere. The people that are being able to connect with people in life, in different groups of community, and I see that as a fundamental thing where we can strengthen communities by being connected and coming together and sharing that sense of belonging, taking away the isolation. So it's really broad when you're trying to think, well, as an organisation, how do you cater for that? Because it's the benefit of our sporting clubs, it's the benefit of different other areas of church groups and so many areas where people can come together. They're already doing that. So we went through a strategic workshop, and fortunately one of the members of our committee I knew through her work at the Ballarat City Council, Deb Weston, who had worked in our aged and disability support area and was across strategic planning. And she facilitated a discussion for us on the night where we just sat around and threw everything on the table and say, how can we make a difference? What are our options? What are our resources that we can do? And we decided that the thing that we could possibly do was to educate people. To educate people to confidently have a conversation with someone who is presenting as potentially suicidal or self-harm. Now we know there are agencies that can do that, and Kevan mentioned one before in terms of Lifeline, that someone at Lifeline will always be on the phone 24 hours a day, 7 days a week. Beyond Blue and other telephone counselling services. But maybe there's a conversation that we want to have with our loved one, or a conversation I might have with David McPhail that I sense that David may not be travelling too well. And I'm thinking, gee, what's going on in David's life? But how do I have that conversation? How do I ask that pointed question? So for us, the issue was let's try and engage people to be confident in that space, to have a conversation with someone who is at risk. And we do that by partnering with Lifeline Ballarat. And what we do through our fundraising efforts, we actually pay for people that they can then access the Safe Talk training free of charge. Something that will take 3.5, 4 hours of their time, cost about $80 per person, but we see that as strengthening the community across Ballarat. And our strategic aim is to say if we can train 100 people a year, we can tick that off that yes, we've done that job. So it means we need to then fundraise to actually deliver that. In the first year of rolling out Safe Talk workshops, I think we trained 113, so we're slightly above the mark. Last year we were over 280. We trained all of the staff at St Patrick's College. We also trained a group of VCAL students from Mount Clear College. And talking to students has been really difficult. For a long time we've tried to get our toe in the door at being able to talk to young people, given the vulnerability of young people and the suicide rate for young people under the age of 35, thinking that we need to have that conversation. This year again, we're on target to be in excess of 120 people trained. And again, going out to targeted vulnerable groups. So that's what we see in that space, something that we can deliver tangibly through our activities, as well as trying to take away the stigma for those people that are walking in the shoes, the hurt that a mother has when her sons have decided to end their life by suicide. Last Saturday morning we had our annual Out of the Shadows walk, where we asked people to gather at the Rotunda by Pipers on the parade at Lake Wendouree at 5 a.m. in the morning. That symbolic nature of gathering in the darkness, because for those that are contemplative are in a dark place. And through our network and our support, my wife and I and my daughters, we put out tea light candles, and we lined the 3.5 kilometre route with tea light candles. So we're there from about 3 o'clock putting those out. But the sense when people come and we understand the rawness of the issue, that for some people that still have those questions as to what did I miss? What did I miss in someone who, could I have done more? That are asking that question and struggling to find the reasons why their loved one is no longer with us, walking on the earth. So we understand how raw that is, and we have 4 reflection points. We light a memorial candle, and there's a couple of poems or pieces that are read. At the floral roundabout by the Robert Clark Centre, we play a piece of music, a reflection point. At the end of the Prime Minister's Avenue, we read out the names of people lost to suicide by family members that request their names to be read out. And this year we read out 112 names. Now that's not 112 people that have completed suicide just in the last 12 months. This is over a significant period of time, but they're still names and they're still people, and they still were loved and they still had a connection to our community. Now, very final reflection point, which I've done now for 2 years, is back on the lake foreshore, with again a piece of music, and we ask people to toss a pebble into the lake that's got the name of their loved one written on it. And the symbolic nature of that, with the dawn of a new day, the sun coming up, with the ripple effect, and just watching the body language of people that are casting the stone into the lake. Some that's a gentle cast, you can see others that are really throwing it. There's still that anger of not knowing why and what did they miss. But some people that came up afterwards, that it was their first time this year. And so we cannot thank you enough for putting on this event. The respect that you had for our loved one. And so we understand that your loved one was still loved, was still a part of your life, was still a part of your world. And whilst we may not understand their choice and the journey they took, they were still amongst us. And we need to therefore make sure we're respectful of that. It's an event ideally we wouldn't have to put on, but we know there is a need across our community for people to come out and walk in the shoes of others and to be able to share that. As I finish up, I just want to leave you with a couple of statistics. That in 2017, 3,128 lives were lost to suicide nationally. That is more than the road toll of every state added together. And yet we look at how much discussion we have around the road toll and TAC and the funding that goes into that, and road safety initiatives, and comparable to mental health. But I think we're getting better at it. We're getting that political will and some momentum around it to begin to take the conversation further and look at the support services that are there. But in reality, at this moment in time, it's probably likely that 8 people across Australia have chosen to die by suicide today. And 8 people yesterday chose to die by suicide. And tomorrow, another 8 are likely to. That's the number that we're looking at. So there's more that we can do, but I encourage everyone, like in the spirit of yesterday of Are You OK Day, that we don't just do that one day a year, we do it every day. We touch base with those people that are around us, we check in. And when we ask them okay, don't just like, I'm just saying okay and I move on to the next question. But ask them genuinely, are they okay? And it's okay not to be okay. And if you're struggling with what that next question might be, or what is the next question that you would have, and you'd like to know more, by all means, we're happy for anyone in this room to come to one of our training sessions that we do for your lifeline. So thank you for the opportunity.
Thank you very much, Councillor Des. That was very, very powerful. Thank you. And of course, don't forget, if some of the things that we've been saying tonight have raised some issues for you, you know that you can speak to Des, or you can also call our lifeline number 13 11 14 or Beyond Blue as well. Please don't keep it to yourself. As Des said, there's always help. For all of us, there's always help. So please don't resist, get all the help that you can get. So now we have some time to just mingle, get coffee, tea. That's the time.